So, we are going to have our last presentation today by Abhishek Pratap Sen on sexual and reproductive health inequalities faced by the transgender youth, transgender men, and trans men. Abhishek is a highly skilled community mobilizer and sexual health counselor with experience in outreaching, education, counseling. He has a proven ability to build rapport with diverse groups, deliver engaging workshops, and provide confidential counseling on a wide range of sexual health topics. Over to you, Abhishek. He will be presenting online.
Hello everyone. My name is Abhishek and I work as a virtual counselor at Humsafar Trust in Delhi, that is in India. Today I'll be going to present my research on sexual and reproductive health inequity faced by transgender youth, that is trans women and trans men specifically in India. And my co-author, Mr. Murugesh, really helped me in guiding this work, and he is working as a chief operating officer at the Himsakar Trust as well. So to begin with the presentation, I would like to mention that young transgender individuals, that is trans women and trans men, often have limited access to SRHR services in India. Being a trans individual, I have also faced these challenges, and this is something which is also very personal to me. And given that the promotion of human rights so youth-friendly care is there that is implemented in India, but it has an impact on the ability of specifically transgender communities to access SRHS services, that is HIV, STD prevention or care. Moreover, stigma and discrimination is often faced by transgender communities, by healthcare professionals, and that also works as a major barrier to accessing SRHS services. Also, young individuals are particularly concerned about their identity to be disclosed and sexual practices to be discussed in detail by healthcare providers, majorly because the healthcare providers are not that much sensitized or even aware to actually understand these. So the objectives of the study was that we implemented a virtual SRHR intervention for the population, and we also reviewed available content, evidences of barriers to services for youth transgender individuals to provide recommendations on expanding strategies to improve access to HIV/STD prevention and also care within this population. The experiences of implementing a complete virtual intervention, including a comprehensive risk assessment tool, provided contextual understanding by barriers to services, successful outreach, and also service delivery mechanisms to the population for increasing access to HIV and other allied services. So the methods that we used was that Humsafar Trust, which is the first community-based organization in India, is as of now implementing a global fund supportive HIV prevention and treatment services linkages intervention, which is commonly known as NetReach. Through NetReach, we are able to expand services virtually to a large population in India. Though the outreach to key and affected population is done completely on virtual mode, a comprehensive assessment of the risk and vulnerabilities is facilitated through NetReach on a virtual platform for community individuals to facilitate self-assessment and also increase overall health-seeking behavior in long run. The prevention model is designed to complement the first 90, that is increasing testing of unreached population of the global UNAIDS goals, which is also an integral part of NACO and also NACP, that is National AIDS Control Program, Government of India. NetReach virtual outreach strategies have been designed considering privacy and autonomy of vulnerable populations. A platform has been developed which facilitates HIV risk assessment through NetReach and also connects clients with a range of services delivered at government and private facilities. Community-led outreach strategies use different social media and dating platforms to share HIV prevention and service information, majorly known as Grindr, Twitter, Bumble, and all these platforms which are majorly used. Assessment indicators on virtual platforms include condom usage practices, sexual partners, presence of STIs, engagement in commercial sex, usage of chemical, other stimulants during sexual acts, commonly known as drugs, and needle and syringe sharing practices, which is very prevalent among transgender community in India. So, as per NetReach data from April 2021 to March 2024, only 889 young transgender identified individuals that were between 18 to 24 years were reached to the program using virtual platforms and dating applications. When this is compared to the other key and affected population groups such as men who have sex with men, that is commonly known as MSM, female sex workers, that is FSW, and drug users, there is a vast difference in outreach itself, which is 49,280, which comes as a quite shock. Of the total reached 889, only 132 individuals, that is 14.8% to be specific, conducted the risk assessment, whereas the risk was conducted by 15,999 individuals, that is 32.2%, in other groups, that is MSM, FSW, and drug use. HIV reactivity rate among young transgender individuals was found to be 5.5% compared to 3.3% among others. So, to conclude, while the youth transgender identified individuals are at a higher risk of sexually transmitted infections such as HIV, among others, the available literature and our experiences of implementing the NETRICH interventions suggest a much lower self-perceived risk, lower health-seeking behavior, and engagement in multiple risk factors such as drug use and sex work, which was very prevalent. Mental health conditions of the population in the gray age group is also severe due to gender incongruence. Lack of sex education and also physical changes coupled with gender identity related issues fuel mental and physical health issues among transgender individuals in India. Moreover, stigma and discrimination phase in different settings, majorly family, education institutions, healthcare facilities, further pushes them away from accessing SRHR services. So, to recommend, it is majorly important to address challenges that are related to SRHR among youth transgender population, which needs a multi-pronged strategy. The strategies majorly would include policy, legal reforms, that is advocacy for the protection of rights to SRHR services that are free from discrimination for transgender individuals, youth-friendly healthcare services, that is developing a culturally competent, inclusive, affirming healthcare environment for gender non-conforming adolescents. Moreover, Unity works in diversity majorly, that is implementing comprehensive, accurate, age-appropriate sex education programs that are inclusive and address the needs of transgender youth in India specifically. Moreover, community engagement is highly crucial as mobilizing transgender communities through support groups and also peer support networks and capacitating them as advocates would also help in building second line leaderships. HIV STD prevention, the promotion of HIV and STD testing, treatment and prevention programs that are very accessible and also affordable for transgender youth individuals. In doing so, they will also promote thriving and health among one of the most vulnerable communities in our society, that is by multi-level reductions in barriers to SRHR services for youth transgender population that disproportionately experience HIV and STD burden. So, when we often talk about SRHR, the SRHRJ, that is justice, is often missing. So, when we talk about sexual and reproductive health and rights for transgender individuals, often also important how legal and policy reforms can also help in providing justice to the individuals who often face these barriers. To conclude, these are the references which really helped me in compiling my abstract specifically, which is the NetReach website. And it would be great if you guys can maybe, folks can go and maybe see how we are working through this Global Fund project and providing virtual services to the community in India. Then another organizational website and also NACO specifically. And to end it, I would like to thank Repro 6 and also the organizing committee for giving me this platform to present my work. And I would just like to say my voice and my rights. Thank you so much.